Hello, today we are going to talk about something on research frameworks. So you may ask yourself, what is the framework? Framework is an abstract, logical structure of meaning that guides the development of the study and enables you to link the findings to the body of knowledge in nursing. So from the framework, it can be used in quantitative research and sometimes in qualitative research. So that means in all the quantitative research, usually we do have the research framework. And in quantitative research, the framework may be a testable theoretical structure. I mean, the theorists already developed the theory, but some part need to be tested. So you may use that theory to test in your study. And another one you may develop inductively from published research or clinical observations. So either you use already existed theory to test, or maybe you used something you developed by yourself. So this is the picture, the conceptual framework or theoretical framework in my study. Remember, my study is related to the family caregiving of dementia in China. So in this caring process from my study, I believe this is really a process from taking care of the patients. So you will have some stressors and you will appraise, evaluate the stressor, and you choose the coping techniques, and then you get the caregiver outcomes. And these contextual factors will influence in your evaluation, your caregiving appraisal, and also influence the coping strategies. So this is kind of, figures or map or structures to describe how many variables, how many concepts in my study, and what I supposed they will be correlated together. So this theoretical framework can help us to understand the variables which we are going to use in our studies. And when you test, you get a result. You will verify if you suppose the relationship has been verified or not verified. You need to think about the reason. So I would like to describe a little bit about the conceptual framework, research framework. Usually in the research framework, we will have the construct or concepts or variables. So what's the difference between this, among these different concepts? So the construct means concepts at a very high level of abstraction that have general meaning. From my conceptual framework, see, this is the construct caregiver outcomes. It's more abstract. And then you will see concepts. Concepts we call the building blocks of the theory, and we call it the terms that abstractly describe and names an object or phenomenon, such as anxiety, right? Grief. And variable means measurable term, which can make a concept more concrete and be measured. So you will tell all these difference among those things. And then I will give you an example about these three concepts. And this example I borrowed from Dr. Gross, Dr. Burns, and Dr. Gray's book written in 2013. So construct, concept, and variable, you will see the line. The construct emotional responses is a construct. It's more abstract. And the concept may be anxiety, or the concept may be grief. And then the variable, how to measure the anxiety, you may use Helmer sweating, or you may use score on grief scale. So this figure is kind of simply describe how the relationship among this construct, concept, and variable. And then when you talk about the concept in the study, you do need to understand when people say conceptual definition or people may say operational definition, what's the difference between these two definitions? For the conceptual definition, it's kind of a theoretical definition to define what the concept is, and operational definition to tell the readers how the researcher will measure this concept. For example, the spirituality is really abstract concept, right? So the conceptual definition is spirituality is defined as making meaning that empowers the self, supports coping, and promotes equanimity. And so how to measure the spirituality is such abstract concept. So from the operational definition, the reader said, spirituality was measured using the spiritual perspective scale developed by Dr. Reid in 1987. Dr. Reid is one of my committee members when I was in my doctoral study. And the operational definition is sum the score on the SPS, this scale, ranging from 10 to 60. So when you see this kind of definition, you will be very clear how you measure this concept, spirituality. And for another example, it's discrimination. What's the discrimination? What's the conceptual definition for discrimination? Discrimination is being excluded, exploited, or treated with prejudice and having one's rights and freedom restricted. This is the discrimination. So from this conceptual definition, you must think about how we can measure it. And so the operational definition is discrimination was measured using the everyday discrimination scale. The operational definition is the summed scale on the scale, ranging from 9 to 54. So in your research paper, when you define the concepts, I strongly suggest you to write down conceptual definition and operational definition at the same time. So you will make the reader more clear about the concept. So this is the conceptual framework in my study, and I want you to see there are many correlated among these kind of variables, constructs, concepts, but how you describe this relationship among this construct, among these concepts. So we call relational statement. Because in your study, there are many concepts, you need to write down what the relationship among these concepts. So usually, the relationship will have several types of relationship, from the positive linear, negative linear, to curvilinear, or maybe from the asymmetric to symmetric, or from the concurrent to sequential causal probability necessary, sufficient, substitutable, and contingent relationship. So this table I also borrowed from the textbook in 2013, written by Dr. Gray, Burns, and Gray. You can read it carefully later. But just for example, the relationship, if the relationship is positive linear, what's the meaning of it? So you will see as A increase, B increase. That means the concept. As A decrease, B decrease. So negative linear means as A increase, B decrease. And negative linear as A decrease and B increase. So this is kind of way to describe the relationship, because when you have this relationship statement, you will get your hypothesis, proposition. So now when you read the literature, when you review the books, the literature, and you find out, you write down all the relationship among the concepts you are very interested in, and you summarize the relationship maybe existed among these variables, and then you move to your proposition and hypothesis. Proposition is more abstract, and the hypothesis a little bit concrete. So we call from abstract to concrete. You should differentiate these two terms, proposition and hypothesis. I will give you an example about the proposition and hypothesis. This example I was borrowed from Dr. Xu's study and her colleagues' study, published in 2010 on the Journal of Addictive Behaviors. The topic of the study is self-expanding and smoking abstinence. And the proposition for the study is because both self-expansion and nicotine appear to trigger feelings of reward that originate from the same parts of the brain, it is conceivable that the reward from self-expanding experience could, at least partly, supplant or act as a substitute for the reward elicited by nicotine or other addictive drugs. So from this proposition, you can have some idea about what's the self-expansion and the nicotine, what's the relationship, right? But it's still a little bit abstract. So let's move to the hypothesis. From this hypothesis, you will have a little bit more concrete images. So we hypothesize that smokers would report greater success abstaining from smoking if they had engaged in self-expanding activities prior to their quit attempt. So this is more concrete. And then from the study, Xu and colleagues has reported that former smokers reported a mean of 4.6 self-expanding events in the 2-month period prior to their successful quit attempt. It kind of supports the hypothesis. So that's the research proposition hypothesis. So I also give you some articles you can read after class, and you will have more ideas about the proposition and hypothesis. And so the next question is how to develop a research framework for your study. So first, you may identify and adapting an existing theory to look for if there are any existing theory can be used in your own study. Because you review the literature, you read some reports, you read some theory textbook, and you read some theory publications. From all these sources, you may make sure if there are any existing theory I can use in my own study. If there is not, don't worry. You can synthesize from the research findings or clinical practice. That means you can develop by yourself based on your clinical practice experience or based on research findings. For example, there is a nurse who are working in the clinic, and they found that the bonding between the mom, the mother, and the infants, and can influence the thriving of the babies. So they developed a framework for herself. The number of mothers' visits to see the infants, and the infants' weight gain will more increased. So this is her framework for her study. And it's kind of very simple case, very simple example, and just give you some idea about how you can develop your own framework from the research findings or from the clinical practice, especially for clinical nurses. If you want to do some research, you may have more ideas from the clinical situation. So use it. And so I talk about, identifying and adapting existing theory if you have. If you don't have, you can synthesize it from research findings or clinical practice. And then you need to define relevant concepts. Remember, define it with the theoretical definition and operational definition. And then you need to developing relational statement. Remember, I mentioned about there are several types of relationship. And then based on that statement, you need to develop a proposition and a hypothesis from the abstract to more concrete. And then you need to construct a conceptual map. This map can clearly describe what's the relationship among all these concepts. So just like this, so you will definitely clearly understand what's the relationship. For example, when the caregiver met the caregiving stressors, and they will evaluate the caregiver stressors. Maybe they have the subject burden evaluation, or they may phrase as satisfied stuff. And then they choose the coping styles, such as the positive coping strategy or negative coping strategy. And then after that, you can get some caregiver health outcomes from physically and psychologically. So, and the contextual factors can influence all the relationship between these concepts. So from this map, you will have clearly imagine how to, to correlate all these concepts. So I want to emphasize again, a framework is the abstract, logical structure of meaning that guides the development of the study and enables the researcher to link the findings to the body of knowledge used in nursing. So that's for today. Thank you, and looking forward to see you next time.